The Fraser Health Balloon Gastrostomy Devices Shared Work Team is happy to present the following video to help healthcare professionals understand and become familiar with the process for replacing a low-profile balloon gastrostomy device. The replacement of balloon gastrostomy devices clinical protocol and clinical skills Elsevier are available here. There is also an accountability quiz on CCRS to help you assess your knowledge and understanding prior to replacing balloon gastrostomy devices. Please take a moment to review these after watching this video.
To ensure you can correctly change a balloon gastrostomy device, you need to observe a previous G-tube change.
Read the clinical protocol, clinical skill Elsevier, and complete the skills assessment quiz. Check the order for frequency of changes, type of tube, and patient-specific requirements. Has it been 2 hours since the patient's last meal or medication administration? Explain the procedure to the patient and obtain their consent. The safest position for changing a balloon gastrostomy device is with the patient lying supine with the head elevated 30 to 45 degrees. For patients with complex seating systems, recommendations from a physio or occupational therapist may be required. Here are the supplies you will need. Note, this is a clean procedure. It is very important to explain the process to your patient. Letting them know what you are doing helps ease anxiety and will make the procedure go more smoothly for both of you. Check the expiry date. Examine the new G-tube. Forgetting to close the ports can result in a mess once the tube is in place. We want to make sure the balloon is symmetrical and has no leaks. Prepare syringes and lubricate the new tube. Personal protective equipment may be required to shield you from splash or spray. Check the skin integrity around the stoma. If there are breaks in the skin, redness, or rashes, contact a physician, nurse practitioner, enterostomal therapy nurse, or wound care clinician for skin care requirements. Use a 10 cc lure or slip-tip syringe to remove the contents of the balloon, ensuring all contents have been removed. Water-soluble lubricant can be used to remove the tube. For pain control, use xylocaine jelly. Gently rotate and remove the device. Examine the tip to ensure it's intact. Perform hand hygiene. If you feel resistance and are unable to insert the new low-profile G-tube, place a smaller French-sized tube to maintain patency and contact physician for further instructions. Instill manufacturer's recommended volume of sterile or distilled water. Do not use air to fill balloon. Do not overfill the balloon. In a 30 to 60 milliliter catheter tip syringe, draw up 10 milliliters clean water. Attach to the extension tubing of the low-profile G-tube to check placement. Gently pull back on the plunger of the syringe and aspirate until gastric content is visible, which confirms that the low-profile G-tube is correctly placed and not in the peritoneal space. If unable to withdraw gastric contents, reposition the patient and try again. If no gastric contents can be visualized upon a second try, wait for 30 minutes and try again. If you are not sure that the low-profile G-tube is in the gastric cavity, do not introduce any feed, fluid, or medication into the low-profile G-tube. Call an expert practitioner in your area for assistance or the primary healthcare provider. Ensure skin around stoma is dry to prevent skin breakdown. Document the following: consent, reason for removal, blocked, leaking, damaged, patient's tolerance to the procedure, any difficulty inserting the G-tube, balloon inflation, French size,
length inserted, external marking, external tube length,
and skin integrity.